The UTMB League City expansion was a new 5-story addition that consisted of 60 ICU patient rooms. In addition to that, we renovated and added endoscopy rooms. We renovated some existing patient rooms, a new helipad. We relocated a CT and X-ray room.
With any project that is up against an existing facility, there's an added layer of expectations from the owner and an added layer of complexity for the contractor. So this particular building, we were expanding onto their existing facility, which happens to be a hospital. Active patients, active staff working right alongside us. Sometimes we're working below them, next to them, above them. So with the renovation work that we did in this hospital especially, we were sensitive to everything that we were surrounded by, because it needs to be a situation where seen but not heard, so that they can continue their operations without us impacting their day-to-day work. So that was pretty critical to the owner to pick the right contractor and us to pick the right electrician and the right plumber and the right subcontractors to make sure that we had seamless planning with those efforts.
FSG's role in this project was to provide a complete electrical system, distribution and lighting. We provided the fire alarm system with our sub and also a lightning protection system.
This project in particular, every single facility, every single utility that we had to tie onto was part of their existing operating facilities. Entire electrical systems that FSG installed, they all had to be integrated and tied into the existing facility. So with our planning efforts, despite the months and months of coordination and planning that we put into place with FSG and other team members, ended up opening up the existing switchgear, and the only thing we couldn't look at in our pre-planning efforts was the only thing that was wrong.
We discovered that the cell that we were supposed to install the new breaker in the existing switchgear for the new tower was not rated to accept our breaker. Therefore, there was a great deal of coordination that we had to do with the gear manufacturer and to upgrade that cell to accept the breaker. That included new busing and new busing tiebacks.
Those challenges, they go a lot smoother when you're delivering the solution to the client when you approach it from the beginning as a team. You don't walk up to them and say, "You have a problem, Mr. Owner, with your existing gear." You walk up to them and say, "We have a problem with the existing gear, and here's what we propose to do."
And that was an overnight shutdown that we had to do the cell upgrade in. And we had to ensure that it was done before the next morning so the hospital could resume normal operations.
One of the things that I praise FSG on is their ability to react to those situations. And it was never an excuse on why they can't complete the project on time or why they can't hit a deadline or why we can't overcome it, right? So FSG was there with us side by side, gut check, recheck, let's get a plan together, deliver that to the client so that we're not delivering them bad news without a solution. They really don't want to hire a contractor that just comes to them with problems. They want solutions. So I found that FSG was, an exact match for us, an exact match for this client.